Welcome. How to deal with infectious diseases? It's a big question, and it's very important to understand the nature of the infectious diseases of poultry, viruses, bacteria, parasites. How can we understand the nature of every one, and how can we diagnose these diseases? What is the nature of these diseases, and how they are interact with the environment and other factors affecting its impact on the poultry industry. The expression of an infectious disease, how it appears in the flock. Three factors influence the expression of an infectious disease. Firstly, the virulence of the causative agent, the level of exposure or the dose of the inoculum, the exposure of the individual bird to the virus or bacteria, and the susceptibility of the host, the immunity of the individual within the poultry flock. Each individual reacts according to the net influence of these three factors: virulence, inoculum, susceptibility. Virulence, inoculum, susceptibility. Factor: the uniformity of exposure and the resistance among the individual in the flock will eventually influence the flock. The flock, a group of individuals. The performance of the flock is the performance of individual. The uniformity of exposure and resistance among the individual in the flock will eventually influence the flock performance at all. Detection and the characterization of the infectious agent. We have a problem in a flock, and we need to identify, characterize what is cause problem, what is the causative agent. There are classical methods: cultivation, isolation, characterization, immunological assay, and this is procedure based on the specific other procedures depend on the molecular genetic characterization of the disease, and this is nowadays extensively used. The PCR for the detection and characterization of infectious pathogens. Diagnostic technology today use variety of sensitive and specific methods that may not require the actual cultivation and isolation of organisms. We take the sample, we send to the lab, and we suspect from our observations, from our PM lesions, that this is Newcastle, this is IB, this is Gomboro. Please confirm our suspicion. Isolation of an agent still has the important place in the investigation process. Isolation is important in assessing the virulence, the pathogenesis, and the development of the vaccine. We still need to isolate the causative agent for purposes of detection of the virulence of this organism, the pathogenesis of this organism, and also making vaccine effective for this virus or bacteria. Detecting technology offers advantage in the number of samples that can be tested in short time and overall efficiency of testing. Now we can rapidly confirm our diagnosis by PCR, very important. Enzyme linked also with ELISA in short time, and it's reproducible, and you can depend on the results. Enzyme linked immunoassay is used. We send the lab sample of serum for sample representative of the flock, about 22, 24 samples according to the number of birds inside, at least 25 samples to be representative for these birds, and we take it from several places, the birds from several places of from the house to be representative, and we take sample, very good quality serum, and we send to the lab, and we can depend on the result of ELISA for detecting antibodies for the Newcastle disease virus, Gumboro, IB, any of these causative agents. The monomerase chain reaction and the nucleotide probe offer many approaches for identifying fragments of genetic code specific to a species or biotype of organism. PCR is representative. A panel multiplex serological assay can reveal the spectrum of infectious agents that have infected an individual bird simultaneously. Sometimes the bird exposed to many causative agents at the same time, and this is a panel can reveal this is multiple infections. Statistical analysis of ELISA titer for various infectious pathogens help to assess the frequency and distribution of infections, vaccine-induced humoral immunity within the flock. Significance of identifying the pathogen and isolates or detected disease agent should be evaluated for diagnostic significance relative to the case history, clinical disease, and lesion. Poultry in commercial flock may experience sequential simultaneous disease challenge as well as exposure to agent in attenuated live vaccine. In diagnostic investigation, both field challenge agent and attenuated live vaccine agent may be detected and require further characterization and differentiation. Examples of the live vaccine include those for Newcastle disease virus, pneumovirus, infectious bronchitis, infectious laryngotracheitis, infectious person disease, chicken infectious anemia, reovirus, hemorrhagic enteritis, mycoplasma, infectious coryza, pasteurella, and other. For example, isolation of infectious bronchitis virus is an important first step in understanding a respiratory disease. We suspect the IV from the symptoms, from the mortality rate, from morbidity. If the virus is determined to be the new serotype, we send the lab PCR and we find this as a new serotype. A significant change in vaccine virus serotype will be required to control the disease. We vaccinate with a certain serotype, IB classical, and we isolate the variant strains of IB. We need to change our mindset and change our attitude in vaccinating program. If the isolate of the virus is distinguishable from the vaccine strain administered at the earlier stage, it may indicate the need for improvement in the vaccine administration or point to immune suppression from infectious bursal disease, chicken infectious anemia, and other diseases. You may be infected or the immunity is depressed. Some vaccine viruses are really isolated for several days post-administration. Extended period of virus shedding in the flock may reflect variable immunity existing at the time of vaccine administration. For respiratory viruses, isolation of vaccine virus for prolonged period after administration can be indicative of the so-called rolling reaction. In this situation, poor uniformity in flock immunity will result in some chick being resistant to the virus infection at the time of vaccine administration, then becoming susceptible during the end of the shedding period of abandonment. The attenuated virus infection spread from bird to bird, resulting in vaccination reaction of prolonged duration. Attenuated virus may reacquire virulence characteristics during this process. Rolling reactions and the lengthening period of vaccine virus isolation also occur with uneven or ineffective vaccine administration technique. The technique of administration of the vaccine individually we give the birds individually by injection or by eye drop this is the best method. Every individual take the dose of the vaccine, and we adjust this dose. In mass vaccination, we put the vaccine in water. We give it for all the birds at the same time. It's a technique. We use this efficiency of vaccination by water. Drinking water is less efficient than individual vaccination with eye drop or by injection. The spray is in between. The spray also ensure that the vaccine is reaching every individual. Method of vaccination is very important. Also, the very correct proceduring in vaccination is very important. Vaccine virus shed from infected bin mats eventually infect susceptible chicken, causing an even and sometimes harsh reaction with the flock. Differentiating vaccine strain from wild type or field challenge virus or bacteria in the laboratory may require molecular genetic sequencing and analysis. The presence of co-pathogen can increase the severity of a viral disease such as infectious bronchitis or the respiratory form of Newcastle disease virus, mycoplasma infections. Other pathogens affect our response of the birds to the vaccine. In mycoplasma infection, elevated concentration of ammonia inside the house. To speak about our whole understanding of the health of our flock and how it reacts for all these factors. The bird surrounded by environment, and this environment should be to some ideal to some extent to gain the profit and the welfare of the birds, affect its performance. Elevated concentration of ammonia, airborne dust increase the severity of the respiratory viral diseases. In these situations, the actual cause of death or economic loss in the form of contamination of slaughter from respiratory compromise or septicemia caused by the Escherichia coli, also Escherichia coli, opportunistic when the depression of the immunity occurs. While the laboratory effort may focus on the viral infections, the cumulative effect of the co-pathogen must also take into the consideration for effective treatment and control. We should be aware of every factor affecting the health of the flock and its performance. The situation requires a comprehensive approach to diagnostic, including virology, bacteriology, serology, and pathology. And you do all these as a avian pathologist or diagnostician of the poultry diseases. Specific pathogen-free sentinel birds are useful in identifying specific primary infectious pathogens. These are typically used when interference from overwhelming co-pathogen or vaccine. Strains obscure the isolation effort of primary pathogens. Sentinel birds can be placed in a flock at specimen time and then brought into the laboratory for pathogen isolation and identification procedures. Selective immunization of the sentinel focus the susceptibility and thereby increase the efficiency of identifying the challenging strains. The relative significance of an isolate also depends on where it has food safety, public health significance. For example, Salmonella, Escherichia, Campylobacter can be pathogenic for poultry. Yes, Escherichia, Salmonella, Campylobacter, pathogenic for the poultry, but even in the apparent absence of the disease, the disease not appear on the as a symptoms on the birds in the flock can be significant contaminant on the processed poultry or poultry product in the slaughterhouse, in the abattoir. This infection can be infection zoonotic for the human being and cause public health problem. Avian influenza virus has strain variable virulence among different poultry species, and some strains have considered public health significance. It's appeared as outbreak H5 and 2, and this was in 1905, 19, and this appeared as an outbreak in poultry, and many flocks are condemned. Disease reporting, the isolation and identification of certain pathogens carries the responsibility of reporting to a provincial or federal regulatory official, who in turn have responsibility to report internationally the reporting disease or virulence or dangerous viral bacterial disease to the World Organization for Animal Health (OIE). The OIE website maintains a current list of internally reportable disease, which include Newcastle disease virus, turkey rhinotracheitis, H5 and H7, avian influenza, Balloral disease, and others. Quality management. A quality management program to include standard operating procedure for the isolation and the identification of infectious pathogens, improve the overall consistency and the quality of the laboratory effort. It's very important to keep our lab efficient in its equipment. We calibrate these devices we use, also train the personnel, and have a manual for every procedure we do, and we can reference our result and compare it from 2-3 labs and reference lab. A quality management program evaluates laboratory procedure for the yield of relevant and timely data. It will involve quality assessment of the specifying performance parameters and setting limits for acceptable performance, and the quality improvement for correcting problems and preventing their recurrences. Quality management helps to ensure that the laboratory information is accurate, reliable, and reproducible, with the goal of eliminating or reducing test variation within and between laboratories, proficiency testing, and lab. The element of a quality program comprise written procedure manuals, record keeping, documentation, retention, training, education, evaluation of the personnel, the infectious diseases need our interest. We need to understand its nature and how can we deal it for the health of the flock and the very good performance. Thank you.